Those highly transmissible variants are a major problem in BC and Alberta. The B.1 variant, first discovered in the UK, is growing exponentially in those provinces. And now the P.1 variant, which first emerged in Brazil, is surging too. As Heather Yourex-West reports, health officials are warning Canadians, even those who have been vaccinated, about the serious risks.
Hospitals in BC and Alberta are bracing themselves for what could be a devastating spring.
We're now seeing the hospital and the intensive care units are younger people between their 40s and 50s who are having devastating responses to these new variants.
But it's no longer just one new variant driving exponential growth. Last week, a large cluster involving the P.1 variant that first emerged in Brazil was identified in the Vancouver coastal region. Many cases linked to an outbreak in the ski town of Whistler, BC. BC Health ordered the ski resort to close as part of new restrictions to control viral spread.
We're seeing the numbers of these P1 variants grow faster than we are for other variants.
The P1 variant first emerged in Brazil in late December 2020. The first Canadian case was confirmed in Toronto on February 7th. BC didn't report its first case until March 9th, but as of April 1st, there were 379 cases, making BC a global hotspot for this highly infectious variant. Alberta Health is also investigating what it calls a significant outbreak linked to a large employer with multiple sites across Western Canada. So far, 3 cases of the P1 variant have been confirmed, but that number is expected to rise.
The emerging data does suggest that the P1 variant causes more significant, worse disease in younger people, worse outcomes, increased hospitalizations.
There is also evidence the P1 variant virus can spread among those that have received a COVID-19 vaccine, though vaccines should prevent those infected from becoming seriously ill.
There are not a lot of direct studies on vaccine effectiveness in P1. They're lab studies. And based on the lab studies, the vaccines that we have in Canada right now do have still an ability to neutralize the virus in terms of the antibody response.
Alberta's Chief Medical Officer of Health did not speak to the media today. Her next update is scheduled for tomorrow after the Alberta government's COVID Cabinet Committee is scheduled to meet. They will be discussing Alberta's rapidly increasing COVID numbers and whether more restrictions will need to be deployed. Robin?
Heather Yourex-West in Calgary. Thanks, Heather.